When a man is newly diagnosed with prostate cancer, there are a few options he can choose from in terms of treatment. Which factors should he consider before deciding on treatment? The majority of men are diagnosed with what we call localized prostate cancer, meaning the cancer has not spread beyond the gland. While some of them might live forever and never die of their cancer even without treatments, others will have much more aggressive disease and will need more aggressive treatment up front. In order to stratify the patient in different risk categories to guide them through treatment, we have used clinical parameters such as the serum PSA, the Gleason score, which is found on the biopsy results, as well as the extent clinically through rectal exam and imaging to build a prognostication system that will guide our treatment. Based on these three factors, we have patients with low risk of disease progression, intermediate, and high risk. For patients with very low risk, active surveillance is actually a recommended modality, meaning close follow-up serial PSA checks and repeat biopsies and treatment at the time of disease progression. Patients who have low-risk disease can choose in selected cases between active surveillance or treatment with radiation or radical prostatectomy. Patients with intermediate grade disease probably should not observe and decide on treatment with either radiation or surgery, and if they choose to undergo radiation therapy, should be treated with 6 months of hormone deprivation therapy. High-risk patients, meaning those who are at the highest risk for progression and metastases, should either undergo prostatectomy or, if they choose to have radiation therapy, will combine this with 2 to 3 years of androgen deprivation. How to choose between surgery or radiation will depend on the patient profile. If the patient is not a good surgical candidate because of other comorbid conditions he has, such as heart disease, diabetes, or advanced age, then treatment is likely to be radiation with or without hormone deprivation. A younger, fit patient, for example, in his 50s, who has no other medical issues and a very aggressive disease, might probably benefit more from upfront surgery. The side effects associated with radiation and surgery are explained by the technique, and I will explain to you in a second. With surgery, the main goal for quality of life is to try to preserve the nerve bundles that mediate sexual function. So for the surgeon who performs this procedure, the question is, can I preserve the nerve bundle safely, meaning without leaving any disease behind? This should be discussed with the patient prior to the procedure. Based on the risk level, the surgery will also entail removal of lymph nodes in the pelvis, which might cause some problems down the road, such as edema. If the so-called urinary sphincter muscle is affected during the surgery, the patient might suffer from incontinence after the surgery. Most of these side effects will improve over time, and by about 2 years after surgery, depending on what study we look at, 30 to 50% of patients will have some decrease of these functions, although they are not very severe. It's important to know that, for example, sexual dysfunction can be treated with implants and medication. So counseling the patient is very important to know that we are able to control most of these side effects. Patients who elect to undergo radiation will have more acute side effects, such as irritable bowel that is in the radiation field and is manifested by frequent bowel movements, urgency, and sometimes also rectal bleeding. But again, these are acute side effects, and most of them resolve over the first 1 or 2 years. The urinary symptoms that patients who undergo radiation experience are explained by what we call radiation cystitis. So it's more the irritation of the bladder rather than interaction with the sphincter muscle. So again, they will have urgency, meaning they have to go to the bathroom a lot. They have some burning sensation, but this over time will improve as well. Sexual dysfunction, on the other hand, is a side effect that will develop over time and increase typically over the first 1 or 2 years in patients who undergo radiation. But if you look at 2 years in most studies, there is not a major difference in terms of long-term side effects of surgery versus radiation in the majority of men. So other medical problems, as mentioned earlier, will help guide the decision making.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.